Hey everyone, I'm Sebastian, this is Matt. We're going to cover a case presentation today, and Matt was going to use his own back as a case presentation. And right before we got on camera, we were looking to see what can we use as testing. And we did something called a straight leg test, which we'll do on him today, because your back really doesn't hurt right now, right?
No.
So it's really common, you go into an office or rehab office, chiropractor's office, it's like, well, let's just get a tune-up. On what? Like nothing's really bothering me because does it bother you ever anymore?
Just on certain squats.
What types of squats?
So back squats, maybe with like 225 on the bar.
Okay. When's the last time you've done it?
Probably like 2 weeks ago.
Okay. So obviously most offices don't have 220 sitting around, right? And so we have to find a way to figure out what to do with you to help you without putting 220 on a bar, right? And we have the same thing with runners and other people who come in. It's like, oh, it's only when I'm running 20 miles. Like, we're not going to do that right now, So the easiest thing is to do just some tests to figure out if there's anything odd. We call them associated findings. And so normally, like people who we're going to do this test on feel hamstring tightness. It's completely normal. They usually won't have knee pain. Okay. Just where everyone can see, just go ahead and take a squat for me. Show the camera your squat. Just to note, you don't really have any knee pain, do you?
No.
Okay. Just the reason I want you to do a couple of these, the reason I'm bringing this to everyone's attention is because at some point someone will have the idea, you know what, it's an IT band or a meniscus or so on. Probably not, because this would usually bother a meniscus, patellofemoral pain, and things of that nature, while things like excessive repetitive movement would bother an IT band. Okay, so these aren't bothering you at all.
No.
Right? Go and line your back for me. So the test we're going to pick is called a straight leg test. It's actually a neural tension test, and so what we're doing is we're dragging or we're tensioning one of the nerves from the back to the foot, down the leg, and seeing if it speaks up and says anything. In a normal scenario, like I mentioned earlier, people say, oh, my hamstring feels a little tight. And then you go further and like, my hamstring's really tight. But overall, they say their hamstring. For you, ideally, we did it earlier to figure out if we can provoke your back, and that's not what happened, right?
Yeah.
It just bothered your knee.
Right.
And you haven't had any knee problems, have you?
No.
So it's really just like this is an associated finding. It's not the primary reason why you're in, but it is something that we can do to figure out what to do with you for your back. Let me know if things tend to bother you.
Just hamstring tightness right there.
Okay. And then we approached a little bit here, and then went here.
Just calf
Yeah.
tightness.
Okay. Trying to make sure not light you up for the sake of the video.
Yeah, right there. Okay. Yeah, it's that burning sensation around the lateral knee.
Okay. Can you show everybody on the opposite knee what you're talking about, the location?
Yeah, so I feel like a burning sensation right in this area.
Yeah. So this is kind of like a phenomenon where, like, how people, I'm sure people think that weightlifting creates IT band pain, like the IT band location. It doesn't. It's like not going to happen. There's not enough reps with it. And so this is not IT band syndrome. This is something of a neural tension disorder, which is very treatable. Okay. Here's what we're going to do then. We're going to, since we're simulating what we should do with you. Oh, sorry. Get the camera going. We'll figure out what to do with you. We need to figure out if this test changes at all during the test.
Okay.
So go ahead and face down for me.
Plug that back in. Start that again.
Okay. Let's go face up. Where do I need to restart?
Face up.
Just where you were squatting down, like, okay, this is what we're gonna do for this, something else.
I've already said there's no IT band.
Yeah.
Okay. He was sitting up, or?
He was about to.
Okay. So here's what we're going to do with this thing. We're going to do one intervention just to see if it makes any change with this single test. Because again, we're not going to have you put 220 in the bar and figure out if it bothers your back. But in theory, this knee problem with this test is your back.
Okay.
It's the same thing, although it's not really your thing while you're here today.
It's related.
It's related. Yeah. So go ahead and go face down for me. Other things for everybody watching, things that could be related to the back. If you go in and go ahead and show me some press-ups. Matt already knows how to do these, so I'm just going to let him rep these things out, and I'll talk to you about it in a sec. He's going to push as high as he can. Pause for a second. Go down again. Go reps just like that. We're going to try about 20. So for everybody who knows, doesn't know, like things that you may find as your associated finding would be like glute pain, sacral pain, excessive tightness of a certain muscle of the leg, like the hamstring or the TFL, as he noted, calf, a tingly foot, plantar fasciitis. All those things are things that could be associated to the reason why he's having this back problem. Okay? You doing okay?
Yeah.
So usually when people do these and they're the right thing to do, things don't hurt. He's going to wonder, why the heck are we doing this? Because it doesn't really stretch my knee and it doesn't stretch my back either. It just feels like I'm doing an arm workout, right?
Yep.
Good.
Pressups.
And that's perfect. We don't want to necessarily have people stretch the IT band or stretch the thigh or the back in this scenario, because that test is what provoked him. We bent him up in the position like so, and so we're just going to do the exact opposite. Give me a couple more. And go ahead and flip over for me. Now, again, we're going to do this retest, but in theory, we can have him put 220 in the bar and do the same thing. He would, and if he got through 1 rep and it hurt, hopefully he would get through 3 to 4 reps and it didn't hurt, right?
Yeah.
So it would be similar to what we're doing with this test here. Okay? You let me know.
Just tightness, no burning.
Hamstring.
Hamstring, calf.
Okay, those are the normal areas to feel it. Just for the sake of making sure, I'm going to go a little further with the range.
Okay.
At some point, a lot of times that wasn't.
Yeah, that's right there.
Yeah, there you, so a lot of times we didn't go through a lot of reps.
No, we went through 15.
Yeah, so we need a lot of times you need to do a little bit more reps and spend a little bit more time. But over the course of a couple days, this may dissipate. But overall, I want to see that the sensitivity goes down, or your range of motion increases.
Okay.
Okay. Some people feel that symptom right here, and you get them to right here, and all of a sudden it's normal too.
Okay.
Okay. So the range increases are going to be important. Do you have any questions?
No.
Okay. Go ahead and take a seat for me then. Other exercises you could do are something like a bird dog, a side plank, probably some version of a plank,
Okay.
maybe a glute bridge. All those would probably be safe to do on this, while something like a hamstring stretch would not, because that's exactly the test that we just did.
Right. Okay.
Okay. But normally this is solvable within about a 2-week period of time in regards to reducing pain with day-to-day function or with the test.
Mm-hmm.
But really, the main test is going to be getting you back into the gym, and try 220 and see what happens.
Sure. Okay.
Okay. If you guys want any help with conditions like this, or you want to figure out what you still need to work on in your body to make sure that you're optimized at the gym or in your sport, reach out to us. We're in Costa Mesa, California. We do virtual and in-person services, so we have consultations online. And as you see, we didn't watch movement with you today really, but in some of our other videos, we watch movement, and you can see what's going on with the person and coach them appropriately on video too. So we also have a webinar in the corner you take advantage of to learn a little bit more about what's going on with your back and maybe how to manage it where you're at as well. So subscribe, like the channel. We'll see you guys next time.